Everyone, my name's Lizzie and today I'm going to be talking about the nurse's role in managing obesity through rehab and feeding strategies. Okay, so let's have a look at what we're going to be covering in today's lecture. So we're going to firstly look at how to implement the right diet and get a good foundation for managing these obese patients. We're going to look at feeding strategies in both cats and dogs. We're then going to cover mental stimulation or environmental enrichment and how to combat feelings of frustration and boredom in these patients. We're going to look at exercise in cats and dogs, and then we're going to look at hydrotherapy as a modality for this. And then I'm going to look at some scenarios involving exercise to hopefully give you a better idea of the types of plans that we'd implement in these patients depending on the current issue that we're also trying to rehabilitate them for. Okay, so let's have a look at the patient that we're dealing with firstly. So they're obese or overweight. They may have joint issues, so osteoarthritis in our cats and dogs. It could be a young dog that has hip or elbow dysplasia, where the dysplasia is still the primary issue that we need to address. Or it could be our post-surgical cases, so perhaps our post-operative RTA in our cat. It could be our dogs that have had a total hip replacement or a cruciate repair. It could be a patient that has a tendinopathy that we need to address. Or it could be those patients that have spinal or neurological issues, and these can be ones that are either being managed conservatively, either for whatever reason they're not a candidate for surgery, or they've got a neurological issue that is doing quite well without surgical intervention. So this may be your fibrocartilaginous embolisms, for example. Or it could be our post-surgical neurological cases, so our post-op hemilaminectomies. Or it could be those patients that have incurred injury. So typically in practice we see a lot of sporting dogs, and I think it's worth at this point mentioning that we shouldn't always assume that these patients are of ideal body condition. I've seen quite a few sporting dogs that have been overweight. Granted, they've not been obese, but they have had body condition scores of 6/9. And I think this is often because the amount of exercise that these patients are doing is greatly overestimated. And they also tend to get fed diets that are quite high in protein and fat. And this isn't always utilised, so therefore they do start to gain some weight. So it's always worth just running your hands and your eyes over these patients and doing a body condition score, particularly because we're going to be asking them to do quite high impact exercise, and we don't want them carrying any excess fat that's going to put pressure and stress on them joints. Okay, so we'll move now on to the foundation of management, which for me is getting the right weight loss diet in place even before we look at exercise. And to do that, we first need to obtain a detailed food diary. So ideally, the owner should be bringing this to their initial appointment, or even better, emailing it prior to the appointment so that you've got enough time to have a good look at this food diary, see what food this patient's fed and the feeding regime of this patient, so therefore you're better placed then to implement different feeding strategies to help. The food diary should include absolutely everything that is given to this animal, including bits of food that's used for medication. That's not so that we can look at omitting these things from their new feeding regime, it's just so that we can factor that in. And it should be exact measurements if possible. So not just a half a cup measurement. Ideally, this food should be put onto digital scale so we've got the exact amounts in grams or ounces. And then this should also include the make and the flavour of the food, which you need that information for when you're working out the calorific values. And then the frequency with which this patient's fed. And that's helpful for when you're implementing your feeding strategies, and also helpful for when you're maybe implementing your home exercise plan. And then how this food's given. So is all of the daily ration given in a bowl? Is some of the food scattered? Are treats or bits of food put in a toy? And then is some of the kibble or daily ration of food or treats used for training purposes, perhaps if it's a younger dog, for example? And then I'll work out how many calories the patient's consuming so that I've got that figure, and then I can compare that figure to how much that patient is actually consuming currently. When these patients are at clinic, I'll obtain a body condition score. I prefer to use the 9-point scale. I find it's far more accurate to use, and therefore it's also easier for owners to visualise and understand what I'm looking for, what I'm feeling for, and where I hope to get their animals to at the end of this process. And then from this body condition score, I can then work out a ballpark figure for that patient's ideal body weight using a simple calculation. And you just take the current weight of that animal, and if it's a body condition score of 6/9, then you'll divide that weight by 1.1. If the body condition score is 7/9, you'll divide by 1.2. If it's 8/9, you'll divide by 1.3. And then if it's 9/9, you'll divide by 1.4. And that should give you a good idea of where that animal should be with regards to their weight. It's far more accurate than using an ideal weight for a breed, because there is so much variation in the size of an animal within a breed that using this calculation will give you a better idea of where they should be. Obviously, as the nurse in charge of getting this animal to lose the weight, it's up to us to constantly be monitoring and body condition scoring this patient so that we can stop that weight loss when they have reached their ideal body condition score. And then we should teach the owner the skill of body condition scoring, because hopefully if they can accurately body condition score their own animal, then this will prevent any weight gain in the future. So we know that any animal that has been overweight or obese and then has lost the weight is at more risk of regaining that weight in the future. So owners need to be able to do this at home, so that if that weight does start to creep back on, that they recognise it early on, and then we can intervene and get that animal back down to where they should be. Being able to body condition score and involving the owner in this process engages them and also encourages a better understanding, of what we're doing and what we're looking for. And then I'll take measurements of the neck, chest and waist. This is more for the owner's benefit than it is for mine. I find that if they can see actual measurements going down, that is a good motivation for them. It will hopefully prevent owner non-compliance, particularly if we've had a couple of weeks where the weight loss hasn't been so successful. And I think we as the nurses, we see visually the benefits of the weight loss more than the owners do, because they are seeing their animal day in and day out, so it's maybe not as obvious to them as it is to us. And then I'll create a weight loss plan. So this typically will be either using a specific weight loss food, which may be the gold standard because these foods have been designed to get animals to lose weight safely but effectively, whilst combating issues that sometimes go hand in hand with weight loss, such as feeling very hungry, and then that then leads on to undesirable behaviours such as begging or scavenging. Or we may have to make adjustments in the current diet of that patient, and in which case you're aiming to match the patient's resting energy requirements times by 1 for their ideal body weight, and that's for weight loss. And there may be a number of reasons why you can't use a specific weight loss food. It could be because the animal has either a diagnosed or perhaps a perceived allergy or intolerance to a certain ingredient. It could be that the owner can't afford the weight loss food. They tend to be a little bit more expensive than your normal life stage foods. or it could be due to the owner's own social or cultural values that they then place onto their animal. But either way, whatever method you have to use to create a good weight loss plan for this animal, it's important that the owner is happy with this plan. It doesn't pay to pressure an owner into choosing a specific food, because they won't be on board, and the plan is likely to fail because the owner isn't happy with what they're doing. So I think we need to weigh up the pros and cons of using each different type of food, and the owner needs to be aware of all the pros and cons of these foods to be able to make an informed decision. But I think at the end of it, everyone needs to be happy with the plan that's been implemented. And then at every appointment, we're going to be discussing, supporting, reviewing, repeating. So we're going to be discussing with the owner how we feel that animal is doing with regards to their weight loss, and how they feel that their animal is doing at home. We're going to be supporting the owner through this process. Remember, they're the ones that are implementing this plan, and there are many psychological and emotional factors that go into feeding an animal. We've got to support them through that. And then we're going to be reviewing that patient as well. So we need to ensure that that weight loss is not only effective, so we want them to be losing over 0.5% of their body weight per week, ideally between 1 to 2% of their body weight per week for optimum results. But we also want that weight loss to be safe. So we don't want that weight loss to be over 2% of their body weight per week, ideally. And we're going to be repeating this at every session to ensure that our weight loss plan stays on track. So this is when regular checks are key. I like to see these patients weekly initially. Not only does that tie in nicely with our rehab clinics as well, but it's to ensure that if we're transitioning onto a new food, that patient has transitioned successfully without any palatability issues. Remember, if the food tastes different or it's maybe not as palatable, then they may not take to it as well. And also that patient has had no gastric upset as well with the transition over. We also want to make sure that if there's any teething problems at home with the new plan, that we iron those out so that we don't get any owner non-compliance. And I think it's important to note that we must manage the expectation in both the owner and ourselves. We might never get that last kilo off that patient for whatever reason. However, it's important that we don't dwell on that fact and that we look at what we have achieved with the weight loss so far. Because even just a 10% reduction in an animal's body weight greatly reduces inflammation. And with regards to pain management, it can be as effective as taking a non-steroidal. So not only do we increase the longevity of that animal with that weight loss, not only do we improve its quality of life, but actually, if we've got an animal that's taking a lot of pain medication, there may also now be scope to start reducing some of that. So weight loss is a very powerful tool. Okay, so moving now on to feeding strategies in dogs. I thought I would address dogs and cats separately because there are some variations. So we need to be mindful of the amount of food that we're going to use for our home exercise plan as part of their rehabilitation. We just need to be able to factor that into their weight loss. So scales are our best friend, and we weigh absolutely everything, not just the patient, but the food as well. And this just ensures that the amount that we're giving per day is an accurate amount. So if for any reason that patient is losing too much weight or too little weight, then we know we can confidently adjust those amounts. So we can confidently increase or decrease the amount of calories they're consuming per day. And then we need to address the frequency of feeding throughout the day. So typically these animals are fed twice a day. It fits in with the lifestyles of people that work or that have a busy life. However, this often isn't the best way to feed patients that we're trying to get weight off. These animals benefit from feeding little and often. Not only does that help with satiety, but it's also better for the metabolism as well. So it keeps it working at a constant rate rather than having long periods of inactivity. There are timed feeders on the market that owners can use if it's not physically possible for them to feed frequently. Or we can use microchip feeders if there's a multi-pet household, and this will reduce the risk of our weight loss patients consuming food from other animals' bowls. We can use a high fibre diet to aid satiety. So this isn't an issue if we're using a weight loss food. These are already high in fibre. However, if it is that we're just making adjustments in a normal life stage food of that patient, then can we look at switching to another type of food that may be higher in fibre, just to see whether that helps. And then scatter feeding. This is an excellent way to feed animals, particularly dogs. It encourages low impact exercise in these overweight sedentary animals, but it also releases endorphins, which make that animal feel better. It's also their natural pain relief. Studies show that dogs much prefer to work for their food than just eating out of a bowl, so it's very beneficial. And then we've got our snuffle mats or licky mats. So just like scatter feeding, not only do they keep brains busy, but also promotes calmness. So licking in particular helps lower arousal levels. So this might be a great way to feed those younger patients that are really suffering with frustration from reduced exercise and not getting that mental stimulus from walking and being outside. Okay, so moving on to feeding strategies in cats. So as with dogs, weigh everything. We need to weigh the patient and their food. We can try scatter feeding of their kibble if they're fed dry. This might work in our cats that are very food motivated. Or we can try using treats perhaps to encourage them. And this will just encourage low impact exercise as well, get them moving more. In cats, we need to be mindful of the type of food that we're feeding them. So a lot of cats are fed wet food, which is great. It has a lot of health benefits. However, this food tends to be more palatable and easier to eat than our dry foods. And cats also tend to eat wet food differently to how they eat dry food. So they tend to gorge feed on wet food, whereas with dry, they tend to just pick at it throughout the day. And unfortunately, owners can perceive the fact that they eat their wet food quite quickly as them being very hungry, and there is a risk that they can then overfeed their pets. So I think we just need to make owners aware of this so that they don't overfeed these animals. And again, there are the use of timed feeders or your microchip feeders in your multi-cat household. I think that the microchip feeders are particularly invaluable for those households that have more than one cat, and they all tend to feed ad lib. And then your hunters. These can prove quite difficult with our weight loss plans, because it really doesn't matter how good that strategy is that you've put in place. There is a risk that they will just go out and source their own food. I would never recommend that we keep these patients inside. Not only do we cut off their exercise source, which is counterintuitive to what we're trying to achieve, but also these cats can get quite stressed as a result, and this can lead to the possibility of them developing undesirable behaviours as a result. So I think the best bet in these cases is to introduce a safety release collar with maybe 1 or 2 bells. So hopefully the prey get the heads up that they're being hunted and have half a chance of getting away. Okay, so let's have a little look at mental stimulation now, which often gets overlooked in these obese or overweight patients that are on reduced exercise. They tend to get quite bored because they're not getting that mental stimulation from being outside and on their usual walks. And unfortunately, then they tend to start to focus on other things, and that thing tends to be food a lot of the time. And we want to try and avoid that in our patients, where our aim is to get weight off them. So not only do we want to give them some form of mental stimulation and tire them out mentally, But brain games will also help encourage exercise in these patients. It will hopefully slow feeding time down because they're not just eating out of their bowl, the food's being drip fed to them. We can increase the frequency of feeding with brain games. So by adding a couple of games into their daily routine and by using some of their daily ration of kibble, we can go from feeding just twice daily to perhaps feeding 4 times a day. And brain games release endorphins, which make the animals feel better, and it's actually their natural pain relief as well. So the caveat to brain games is that we just need to watch for signs of frustration, which can stem from the game being too difficult and unachievable in these patients. So to be safe, we best start off with games that are easy and then work up to more difficult games to avoid this from happening. Okay, so here are some examples of brain games that we give to owners in practice. So on the left, there's the snuffle mats that I've talked about previously. You can either buy these ready-made, or there's some brilliant videos on the internet that show you how you can make them, and they're quite easy apparently. And there's your scatter feeding, there's your stuffed Kongs, either with fresh food, which is quite an easy game for them, or you can make that game more difficult by freezing that food. And then there's your slow feeders, and then your hide and seek games just with using a child's ball pool pit. And then on the right, there's brain games or environmental enrichment that you can actually make from things that you've got lying around the home already. So you've got your toilet roll tubes in a Tupperware box, your cake tray and balls, just a tennis ball that's been slit open and stuffed with kibble or treats. So these brain games can be relatively inexpensive and easy to create. So looking at exercise now in these patients. So there's limitations due to their obesity. We know their excess weight is going to adversely affect their joints, their respiratory and cardiovascular system. But there are also lots of other issues that we might need to consider as well, namely the condition that we're treating and rehabbing these patients for. So actually it becomes multifactorial, and all these factors will then affect the duration, the frequency and the type of exercise these patients can have. It may actually be necessary to advise even more of a reduction in this patient's exercise in the short term to facilitate their rehabilitation. So in clinic we see quite a lot of very painful arthritic patients. Either they are having a flare in their arthritis or they've got wind-up pain, and in which case we need to address first their pain medication regime and allow that pain medication to take effect. And we'll probably advise that these animals actually stop exercise and just have toilet breaks for a week if they are very painful, just to give their bodies a rest, give their joints a rest, whilst the pain medication starts to work, before we then start to increase their exercise again and allow that exercise to help facilitate not only in pain relief, but also to help facilitate their weight loss as well. So in patients where their weight loss is very much dependent on the amount of exercise that they're doing, it may be that whilst we're advising a reduction, we just have to try and focus on keeping their weight loss or their weight stable rather than focusing on weight loss at that current time. So we need to look at our home exercise plan that we'll be implementing into these patients' rehab as well. These exercises encourage movement and help strengthen, but these exercises often require some form of reward as well. So we might be lucky and these animals might just be quite happy to take some of their daily ration of kibble as reward for these exercises. However, it might be that they require a higher value food, and in which case that's fine, but we need to be able to incorporate this into the weight loss plan. So in summary, exercise is vital as it facilitates weight loss, but we can't rely on this alone. Successful weight loss must have the foundations of the correct diet. So looking at hydrotherapy now as a form of exercise. It's an excellent tool for encouraging exercise in the obese patient with any mobility issues. It adds buoyancy, which takes the weight off them, which should make them feel better and then in turn encourage them to move. Water has a hydrostatic effect, so in this it forces blood back to the heart, which stops blood pooling in areas such as joints. This is particularly beneficial for our arthritic patients. Water adds resistance, which we can use to our benefit to help build muscle and strengthen. And the hydrotherapy is excellent for mental stimulation, so it tires these patients out mentally as well as physically. Okay, so when we are looking at hydrotherapy, one of the options is swimming. And that's excellent for cardiovascular fitness and for weight loss. However, it's not suitable for all rehabilitation cases. Some dogs don't like swimming or can't swim, or it could be that actually they've got an issue that we're rehabbing them for, whereby at that current time swimming isn't advised. Dogs predominantly swim with their front legs. It's very much a front end action, and it could be that the amount of pressure that we're putting on those forelegs by swimming could adversely affect their rehabilitation. Occasionally there are pools that do have different levels built into them so that the therapist doesn't have to rely on swimming, and they can do different exercises with the patient standing on all four legs and use the different levels to increase or decrease the water heights. Swimming can be restrictive. Sometimes there are harnesses or buoyancy aids that are used, and some patients don't get on with them. And we need to be mindful of those patients that have a heart condition. So by no means are we saying that we can't use swimming then. It's very much dependent on the heart problem that the patient has and the severity. And it just means that everyone involved in that patient's hydrotherapy needs to be extra vigilant as well whilst that patient's undergoing that treatment. The other option to hydrotherapy is the underwater treadmill. As with swimming, it's excellent for cardiovascular fitness and for weight loss. However, it has the added benefit that it builds muscle in both the hind legs and the forelegs, not just the forelegs like with swimming. We have the ability to adjust the water heights to add or reduce resistance to benefit us and what we're trying to treat. It can be used in most rehabilitation cases. It's very versatile. And again, as with swimming, we need to be mindful of those patients with a heart condition. Okay, so here's a video of a patient we're currently treating in clinic. He's got a body condition score of 8/9 and he has lumbosacral issues that are currently well managed. However, we're continuing to use hydrotherapy to facilitate his weight loss, but also to strengthen him and to keep his spine flexible and mobile, which is really important in these dogs that have lumbosacral issues. Okay, so looking at some scenarios involving exercise. The first one is our post-operative TPLO. I've chosen to use this approach to cruciate repair because it's a good stabilising technique and typically these patients recover well with minimal issues. So firstly, we must be guided by the surgeon's recommendations, but it's fair to say that in the first couple of weeks, this animal is going to be on toilet breaks only. So this is when we need to implement our environmental enrichment to help combat frustration. We'll then introduce lead walks, and we'll start at 5 minutes on the lead twice a day. And then as long as that patient's improving and we've got no post-operative complications, we'll start to build that up. We'll implement a home exercise plan that first focuses on range of motion and weight bearing on the affected leg before we then start to focus on strengthening. These exercises will also look at supporting the good leg or the unaffected leg. We know with cruciate issues they can be bilateral, so it's really important that whilst we're rehabbing the affected leg, that we also support the good one. And then we'll implement the underwater treadmill at around 4 weeks post-op. And this will continue to encourage range of motion and weight bearing, but it will also start to strengthen those hind legs as well. And then our aim moving forward is to increase walking gradually until that patient can exercise for the duration they did prior to this issue. If the patient had off-lead exercise, then we will start to reintroduce that. We start at 5 minutes off-lead at the end of the walks. And the theory behind this is that hopefully that patient's burnt off enough energy during the lead walk to prevent them from being silly once they're allowed off-lead. We'll modify the home exercise plan to continue to challenge that patient, encourage weight bearing and strengthen the hind legs. And then we'll increase the time that the patient's in the underwater treadmill to continue to facilitate weight loss and strengthen those hind legs. Okay, so one example of home exercises that we would give to these post-operative TPLOs is one called biscuits to hips. And you can see here that as the treat is moved from the dog's nose and guided round to its hip on either side, it encourages weight shifting from one side to the other, and this will encourage weight bearing on the affected leg. So another type of exercise that we can use in these patients is one called poles. It's excellent for encouraging range of motion in the stifle because it encourages these patients to pick their feet up. They don't want to knock their feet on the poles, so they will try harder at picking their feet up. It's also great for encouraging proprioception, so giving those dogs a better idea of where they're placing their feet, of where their body is in general. We can increase the difficulty of this exercise by increasing the height of the poles or making the height of the poles different on different sides to further challenge their awareness and proprioception. So we can also use the wobble cushion exercise in these patients. So we can either use a cushion or a hot water bottle that's been filled with air. And the idea is that we put the affected leg on that wobble cushion, and then we hold the unaffected leg up, encouraging all the weight to go through that leg that's been operated on. And there are set amounts of time that you can hold that leg on that wobble cushion for. However, the idea is that when you start to see that leg shake and those muscles tiring, that's when you stop the exercise. But as you continue to do this exercise on a daily basis, the owner should start to notice that the amount of time that affected leg can stay on that wobble cushion before tiring increases. You can increase the difficulty of this exercise by taking more air out of the hot water bottle to make the surface more unstable, or you can use your fingers to press down on different areas of that hot water bottle to make the surface more unstable and challenge that patient further. So another form of exercise that you can use in these patients that you can actually incorporate into their walk is uphill walking. This is excellent for encouraging weight bearing but also strengthening, and you can modify the difficulty by changing the gradient of the hill that they're walking up. So you can start off with quite a mild hill, but as they get better you can then go to using quite a severe gradient on the hill. You can also increase the time at which they're expected to walk up the hill as well to continue to challenge these patients. So the second scenario we're going to look at is elbow arthritis. And the amount of exercise that these patients can do is very much determined by the degree of lameness, the amount of pain that these patients are currently in, and the degree of range of motion. It may be that we ask owners to stop all ball games and playing with the dogs in the short term, just to help facilitate rehabilitation and get on top of issues such as weight bearing and pain management. We know that these games tend to be quite vigorous and it can actually further exacerbate issues such as arthritis. We'll look at implementing a home exercise plan, and this again depends on how well that patient's currently doing. So if we've got a very painful elbow arthritis case, then it may be that we look at passive range of motion exercises initially with the use of heat to facilitate this. So we ask owners to place a warm wheat bag or a warm wet flannel over the affected elbows prior to the range of motion exercises, and this just helps warm the joints, helps warm the muscles and the tendons around those elbow joints, which will have a pain relieving effect, but it will also make these range of motion exercises easier. And then we can move on to looking at weight bearing exercises and then strengthening exercises. We'll use hydrotherapy. So the underwater treadmill will help relieve pain. It will encourage movement in these patients and also help with their range of motion. And we know that if we increase resistance in the underwater treadmill, this will help strengthen all the muscles in those forelimbs as well, which is important, particularly if they've not been weight bearing. There will be muscle wastage there. And then our aim moving forward is to increase the lead walking exercise gradually. And in patients where they had off-lead exercise prior to the diagnosis of elbow arthritis or any setbacks, we'll start to introduce the 5 minutes off lead at the end of the walks. And this off lead time will continue to increase as long as the patient continues to do well. We'll reintroduce ball games if they had ball games previously. However, we would always advise no overarm throwing, even in a dog that didn't have any issues. Overarm throwing just encourages dogs to leap up into the air and twist and turn and catch the ball and then fall in some horrendous manner. So we always advise either underarm throwing, so the ball's always kept low level, or that we throw the ball and then wait for it to land before the dog retrieves it. If a dog is very ball motivated, there's always the option, if we don't want to have any ball throwing games, to use games where we hide the ball and get the dog to search and retrieve it. We'll reintroduce play with other dogs as well when we're happy that patient isn't in any pain and that they are, using that leg well and weight bearing. We'll continue to progress the home exercise plan to further challenge that patient and to continue to encourage strengthening and range of motion and weight bearing. And we'll increase the underwater treadmill sessions to build muscle and strengthen forelegs whilst facilitating weight loss. Okay, so here are our passive range of motion exercises that I mentioned in the previous slide. And the idea behind the passive range of motion exercises is that the patient doesn't have to actively move the elbows themselves. We're relying on the owner or the veterinary professional to flex and extend those joints for them. So after we've used the warm wheat bag or the warm wet flannel over the joints to help with pain relief and to help warm the joint and the muscles and the tendons surrounding those elbows, what we'll do is we will use one hand to support the elbow. So we'll place it behind the elbow and then we'll use the other hand to flex and extend those joints. Okay, so when we're looking at introducing a home exercise that focuses on weight bearing in the forelegs, in these cases of elbow arthritis, we can introduce one called step down front legs. And the aim is that the dog is placed on some stairs, and it could just be one step or 2 steps depending on the size of the dog, and the back end has to be higher than the front end. So this will encourage weight shift to the forelegs, and this hopefully will encourage them to weight bear more on the front legs. And then this will also in turn encourage some strengthening in those forelegs as well. As these patients get stronger and can weight bear better on these forelegs, we can continue to challenge them by increasing the repetitions that we do of this exercise and also the frequency of which we do this exercise per day. Okay, so another exercise that we can introduce into the exercise regime of the elbow arthritis patient is one called down to a sit. So not only does this exercise encourage weight bearing, but it also encourages range of motion. So the idea of this exercise is to start the dog in a down position and then using a treat or some food, give the sit command and have them come into a sitting position. And then we ask them then to return to a down position and treat. And the idea is that this movement of a down to a sit to a down will increase range of motion in that elbow joint. We can then increase the difficulty of this exercise by increasing the repetitions of the exercise and also the frequency of which we do this exercise per day. Okay, so another home exercise that we can implement in the rehabilitation of elbow arthritis is one called doggy push-ups. Not only does this continue to encourage range of motion in those forelegs, in particular in the elbows, but it will also strengthen those forelegs, so help build muscle and help strengthen and support those elbows. You can increase the difficulty of this exercise by increasing the repetitions of this exercise and also increasing the frequency of which you do this exercise in a day. Tug of war exercise is one we'd introduce when we just wanted to focus on strengthening, when we were happy that that animal wasn't in pain, it had good weight bearing, good range of motion, then we could introduce a more vigorous type of home exercise. Tug of war is excellent because actually it can be modified to focus on back leg strengthening. So when you're foreleg strengthening, you play tug of war low down, where the head's low down and they're very much driving with their front end. However, if you wanted to switch to focus on the back leg strengthening, you'd play tug of war high up, so they were driving, pulling and pushing with their back end. The caveat to this game is that it's not to be used in any dogs that show any form of aggression or resource guarding. This game is likely to exacerbate that behaviour. And challenge standing, I thought I'd throw this exercise in because it's excellent for improving weight bearing on all four legs, but it's also excellent for balance and proprioception and for core stability, which I think gets overlooked in these overweight patients. You know, we tend to focus a lot on strengthening the limbs that we've got the issue with, but actually we really should be focusing on strengthening that core as well. So this is an excellent exercise. It's a good all-rounder really, and we can increase the difficulty in this exercise. For example, if the dog's on a trampette, we can use our fingers again to make that surface more unstable, or if we're using an airbed that's been blown up, as with the wobble cushion, we can take air out of that airbed to make that surface more unstable, or we can ask them to walk over it, which can be quite challenging. Okay, so looking at exercising cats now, a little bit different to dogs, so they're a bit more tricky to encourage. However, we can implement games that mimic their natural behaviours, such as catching prey and chasing. So therefore you can use laser lights or the chasing of a toy. However, I think we need to make owners aware that playing this game for too long or the game not ending in success for them can lead to frustration in these cats, which can then lead to overeating. And we want to prevent that because that's counterintuitive to what we're trying to achieve. We can try scatter feeding if the cat's quite food motivated, or we can use food trails with treats perhaps. However, we do need to factor that into their weight loss plan. We can try introducing toys that incorporate food. However, this can have varying success. And then looking at maybe our obese arthritic cats that have lost confidence going outside and have become more sedentary. Maybe if the owner tried spending more time outside, that this would encourage those cats to go outside as well, with a safety net of their presence. And then hopefully once we've got on top of any pain management issues and we've got on top of their weight loss and they're losing weight and they're feeling better, they might then start to go out again more, and this will further help facilitate their weight loss. Okay, so I thought I'd throw in a little video here of my cat Moo, demonstrating how even just the use of a scratching post can be beneficial. So it can be really useful in increasing range of motion in the forelimbs of cats. And that's useful if you've got a cat with elbow arthritis. Perhaps it increases the range of motion in those elbows. And actually the act of scratching can be beneficial as well because it's quite a strengthening exercise to scratch. So that can be helpful. And if you've got any toys or ropes attached to that scratching post, that can actually initiate a more vigorous form of play, which will help incorporate more exercise into their routines. Okay, so take home points from today's lecture. First, we need to implement a calorie restricted diet for weight loss that's tailored to that individual and their needs. We need to use clever feeding strategies to help prevent issues with satiety, to help regulate their metabolism and encourage low impact exercise. We need to introduce an exercise regime that will encourage weight loss whilst being mindful of the limitations of the obese patient and any concurrent issues we may be treating in that individual. And success is reliant on a good relationship between the owner and the nurse and the strategies that we've implemented working in synergy. I hope you've enjoyed today's lecture and thanks for listening.